All right, so on the first leg of the program this morning, we are continuing the dialogue on clinical excellence, and we're looking at it from the Rjolad, of course, way. We started that campaign on Friday, and my guest was here to, give us an idea of how it works, but we're going to be continuing on that particular leg this morning. And joining me in the studios, I have Dr. Otegwono Ogumo. He's a medical administrator for Rjolad Hospital. Dr. Otegwono, good morning.
Good morning, Victor. Thanks for having me again.
How was your weekend?
Oh, it was lovely.
It went well?
Very well.
All right. So when we talk about clinical excellence, I'm sure a lot of things comes to mind. But in today's world, it goes much more than the equipment. And that's what Dr. Otegwono was able to make us realize on Friday. So let's, just take off from where we stopped on Friday. What is the definition of clinical excellence? How would you define that for our listeners this morning?
Okay, so to bring context to what we're talking about this morning, clinical excellence, I just want to firstly talk about the mission of Rjolad Hospital. That will give us some background about what we are discussing. Mm-hmm. We are on a mission as a facility, as a hospital group to, we are building healthier communities by delivering best-in-class patient-centered care.
All right.
Through a culture of teamwork, innovation, research, and data-driven excellence. So for us, clinical excellence, if you look at that mission that we have as a hospital, it's delivering an experience that is patient-centered every time and every other day. Okay. So it is about patient-centeredness and efficient kind of care that is effective, that is safe, that is innovative. Yes, that's the kind of care we are delivering in Rjolad Hospital.
It's all woven around the patient, right?
Yes, all
how
around
the patient can get the kind of comfort that is required.
Definitely, yeah.
And how many of your branches can boast of doing this?
So, we have 4 hospitals within the group currently. We have 2 in Bagada, we have 1 in the Solo, we have 1 in Agege, and we have spokes that are clinics across the group. We have 1 in Agege, Pensinema, we have 1 in Shomolu, Bawala, and we have another 1 in Ikeja, in the Jara Mall, just under the bridge.
And you can say all of these 5, how many of them now?
So 4 hospitals and 3 clinics.
Yeah, so all of this you can say have that culture of excellence which you're talking about.
Yeah, so because we run with a policy that is standardized and we have protocols that guide what we do across the group. So what you've experienced in one particular branch is what you're going to experience in the other branch.
All right. Update from the control room says the earlier impediment around Otoiba Wharf has been taken up, so it's a much better drive if you're navigating through that corridor. Just asking about the update on the Lagos Badagry Expressway earlier on, and that has been sent in by the control room. All right, so let's look at it, because on Friday you were mentioning the 5 pillars.
6.
Or 6 rather.
6 pillars.
Yes, which has been recommended by the World Health Organization, which really qualifies any health facility as being existing within the framework of clinical excellence. Talk to us. Let's rewind a bit. What are those 6 pillars?
Okay, so just to recap, it talks about safety. That means delivering care that is not harmful both to the patient and even the one that is delivering the care. It talks about effectiveness. That is not be scientific driven, not local or native intelligence. We talk about care that is patient centered, that considers the patient value and considers the patient's opinion. We talk about care that is timely. Right procedure, do procedures at the right time, giving care that is timely. We talk about efficiency, care that maximizes resources and reduces waste. Then we talk about care that is also equitable, that does not deliver care that is based on social status. Yep. Okay,
so these are the 6 pillars.
Yes.
And you can say for sure that these 6 pillars you guys are meeting up?
So it is important to really address that, because again, if you look at what I've just said, the mission of Rjolad, if we really want to build healthier communities, which is what we are doing as a group, we build our services with these pillars as the framework of what we do.
All right, then flash update from the control room as well says there's a breakdown of a truck with a battery and clutch problem. This is at Jonathan Coker on the rail track. Wow, on the rail track there at Jonathan Coker, and I understand a tow van has been contacted for quick resolution. That's not a very good place for it to break down. All right. Articulated vehicle with battery and clutch problem. That's causing some headache there.
Good morning.
Hello there. Good morning. Yeah, good morning.
This is last morning to Oguba Meru.
Okay, Oguba Meru, talk to me. Where are you calling from?
I'm coming from Abulegba, from Iju Shaga side.
All right. Talk to me.
Please, we've been trying to link up with these things.
Right.
There is a trailer that blocks railway crossing at Jonathan Coker.
Okay.
By Iju Shaga area there.
Right.
So the train has to stop. The train in motion has to stop now. So we're making efforts to remove the trailer out of the rail track.
Okay. All right. Just
so, it's not causing any gridlock. Vehicles still are moving. The train has stopped already for the trailer.
All right.
So until when we remove the trailer from the rail track, before the train can move again.
Very good.
So that's what I want to tell you.
All right. Thank you so much.
You're welcome.
All right, so that's from the Jewish Shaga corridor. I was just talking about that impediment on the rail track there at Jonathan Coker. It's crossing the road there, and efforts on to get it fixed so that we don't have any untoward incident. But the good news, at least the train has been contacted so that we do not have any secondary damage in terms of another accident. All right, I see here with me Dr. Otegwono Ogumo. Of course, he's the administrator. We're talking about clinical administrator for Rjolad Hospital, and we're looking at what clinical excellence really means. So there's a whole lot that comes to play when we talk about clinical excellence. The aspect that relates to the facility itself, how is Rjolad performing? Let's look at that from that perspective. The health facilities that you guys have, you said 4 major hospitals and 3 clinics, right?
Definitely, yes.
Right. So how is Rjolad performing in that regard?
So we, as a hospital, we leverage a lot of
okay,
technology.
so we can hardly hear you now.
So as a hospital, we leverage a lot of technology because we know that technology is an enabler. So what it does is that it has helped us to ensure that we have electronic medical records across the group. That helps to coordinate care, whether you are in a Gege branch, or you're in a Solo branch, or you're in Bagada branch, or within our spokes, which is the clinics. We're able to coordinate your care through the technology we have leveraged using electronic medical record across our group. Also, we also have advanced image technologies we use within the group, like the CT scan, the mammograms, the 3D ultrasound sonography.
All right.
What this does is that it helps us to make your diagnosis, helps to improve our diagnosis and ensure that patients get the right kind of care that they require.
All right.
Then also, we are also leveraging on telemedicine, which also helps us to improve access to care, because you know that not every single person would want to can access the building, and we know that the world is changing seriously, and people are beginning to come into the hospital. People do not want to come into the hospital for minor things like drug refills. So what they want to do is that they want to make a call, talk to a doctor, and just walk into the hospital and get their services. So what we do is that we leverage telemedicine to ensure that people can reach out to the doctors and even get this conversations and get their prescriptions done. They come and just pick up their drugs.
Right. So all of that, in terms of the infrastructure, is there for what you're saying now.
Yes, yeah. So we have a comprehensive array of our emergency department. We also have an intensive care unit that caters for people that require that kind of service. We have the diagnostic service. We have the laboratory service across the group. We also ensure that we have safe delivery. We have trained, qualified midwives and specialist obstetricians who handle this. We ensure that we have successful surgical outcomes, because we believe that people that should perform surgeries must be credentialed and will have the adequate required qualifications to perform such. And beyond all of these, we also ensure we do compassionate follow-up for our patients after they've done their procedures of the admitted or discharge from the hospital. So this is what we do as a hospital.
All right. So in terms of communication now, because I know we also touched base with that last week Friday. So what are the communication tools that you guys have to ensure that all this that you are talking about can be properly articulated to the patients?
Okay, so we do ensure that when we talk to patients, like I said the last time I was here, that we have what we call family and patient education. So we ensure that we elicit from the patient that they understand what we've explained to them. And beyond all of these, when patients do not understand what is being done to them, we allow them to give us feedback. We talk to them. We have a group within the hospital, the patient experience department. They go around every day and talk to patients about their experience, what challenges they have, and how we can improve. Because we know again that feedback is key, and just like positive feedback is good, but one of the things that can make you improve as a group or as an organization is when people give you feedback that can help you improve. What they call negative feedback is key, and it helps you to improve your services. So those are the things we use.
All right, let's talk about training now, because of course you talk about training really, but what's Rjolad doing in terms of investing in training for your medical staff, those that are skilled, right?
Yes.
Talk to me. What are you guys doing?
So when you talk about training in Rjolad, we can proudly boast that we are among the best that train their staff, because we are a private facility currently, and we have training programs for residency for family medicine. That alone is already adding value to the economy, and also helping with the training and retaining of specialist consultants within the hospital, and also within the Nigeria health sector ecosystem. We are also investing intensively on training, because we have intensive internship program for house officers. Beyond house officers, we have internship program also for radiologists. We're in the process of onboarding other internship programs or other residency programs, which we believe they're going to be unfolding by next year. And these are the things that we are doing to ensure that we are able to train and retain our staff.
All right. So as we speak right now, what is the staff strength of Rjolad? What does it boast of? I mean, if you had to put a figure to it, like what's the staff strength like?
So the staff strength of Rjolad Hospital,
okay, is what? Go ahead.
So we can. It's a group of hospitals across the group from the various branches.
All right.
We should boast over more than 500 staff.
Wow.
But that
500.
figure might not be correct, but should be above that.
Wow, that's huge. Let's see. Do you have a call? Let's we can take that 08099120777 and 09153877127. This morning we're talking clinical excellence, and we're looking at it from the perspective of Rjolad Hospital. And of course, if you want to also add your voice to the conversation, feel free to give us a ring on those numbers, and then we can hear from you as well. So 500 in terms of staff, or even beyond that?
Thereabout, because we have full-time staff and some other services staff that support our
auxiliary services,
yes,
right?
That support our group here.
All right, and that means a whole lot in terms of putting all of this and making it a culture. How are you able to carry all of them along? They were able to understand what you're saying.
So we have what we call the orientation program. Before you can work in our Rjolad Hospital, you need to go through our orientation. So during the orientation, we try to ensure we drive across to you our values, which I've talked about the last time, which is the we care value, which we need to let you understand that we do not just treat illness. We are whole. That is, we treat the whole human being. That is the W in the we care. They will also make you understand that we are empathetic. That's the E in the we care. That's we are empathetic. We put ourselves in patient's shoes. Then we are courageous. We are not afraid to make decisions, and we're not afraid to change when things really need to change. We empower our staff to be courageous. Then we are also agile, which is the A in the we care. We are dynamic. We're able to change the trends, and we're able to follow the latest scientific changes and also adapt to them.
Right.
Then we are responsible. We take full responsibility for our actions. We do not shy away from things that were supposed to be. When we have responsibility to carry out, we do them. And also have the last, which is the E. We ensure that we deliver excellently. We have an excellent spirit within the group.
All right, 08099120777. There's a message here. It says, sir, does clinical excellence also include how nurses treat patients, or is it just about the doctors? Bolaji is sending this one in.
Okay, so clinical excellence, like I said, the work within the hospital group is not just within the doctor. It cuts across beyond even the doctor, beyond the nurses. It cuts across to the security man at the gate. Yes, so it's all from the security end to end. It's not just the doctor's responsibility.
All right. This one says, hi, doctor. Does Rjolad have facilities for cancer screening or treatment, or do you refer patients elsewhere? Sheon Ibrahim.
Okay, so as a hospital, yes, we do have facilities for cancer screening. When you go above 40 as a man, you need to do what we call colonoscopy, which is something that you should do to check your colon. Then for the women, we have an advanced mammogram machine currently in our facility where we can screen people that should above 40 and above to check if they are predisposed to having breast cancers. Yes, we have screening tools for cancer.
All right. So
and also blood works can also be done. We have a well-equipped laboratory to check for blood works that can help you detect.
Okay then, so I hope that answers your question. Shehu Ibrahim, 08099120777. This one says, good morning, doctor. Many of us feel healthcare is becoming too commercial. How do you personally ensure that patient care still comes first at Rjolad? Itunu is sending this one in from Bariga. Itunu, thank you.
Okay, so we as a hospital and as a hospital group, like I said earlier, if you understand what we are doing, we are building, like I said, our mission to build healthier communities. Yes, even though they think people might think healthcare is commercial, but for us, our focus and our vision is to build healthier communities, and we are doing that by delivering best-in-class patient-centered care. And we have a vision, and we are ensuring that we follow that vision with this mission. All
right, then 08099120777. A Jushaga corridor, will they tell you there's a broken down truck with a battery and clutch problem? This is at Jonathan Coker on the rail track, and you heard from traffic manager Ogumba Meru a short while ago that they've been able to put a halt to even the train service at the moment until that articulated vehicle will be taken off. So a tow truck already contacted, and then you can have it better. Those of you making the journey to the island on the Third Milan Bridge are also having it slow as a result of the early accident between a tanker and another vehicle on that particular bridge. But of course, both the vehicles are being taken off, and so they're dealing with the backlog right now. This one says, please sir, why is it that cancers are increasing these days? Is it lifestyle or environment? And why there still isn't a permanent cure for cancer? B is sending this one in from Ogba. B, thank you so much. I think he's putting two questions in one.
All right, so we'll be doing some webinars, next year. It's part of our way of educating the public. So this is something that we'll be looking at and we'll be discussing next year. So the person should just watch out on our platform, log into our website, www.rjolad.com, to find out the webinars that will be coming up. And if they want to know more, they can also make a call to our customer center, which is 07000 756 and 523. Yeah, you can call that number to find out when webinars will be coming. It's part of what we do as a group. We're going to be discussing some of those things into the new year.
Right. Okay then, so part of what we even talked about on Friday is Rjolad is a winner this year, right?
Yeah, so we won in the Nigerian Healthcare Excellence Award. We won the best secondary healthcare provider of the year. Yes.
Wow. The best secondary healthcare provider of the year.
Private secondary healthcare provider of the year. So
congratulations to Rjolad for this feat. And this will definitely ginger you to doing better in 2026, right?
Yeah, so, they say the reward of hard work is what?
It's more
work, yes. So
and you guys are ready to do the work.
Definitely.
All right, so let's begin to look and project into 2026. So what new or what else, what should be the new thing that we should be looking up to from Rjolad next year?
So for us, we know excellence is not static. It is not a position. It is dynamic. It is changing. So as a group, we believe that as we get into the new year, we need to continually, just like our value is being agile, we need to understand that we need to keep up with excellence. We are going to be getting feedback. One of the things we're doing, we're getting feedback from our clients. We'll be investing intensively into training and retraining of our staff to ensure that they have the latest up-to-date trainings and clinical expertise to deliver care. And also we will be ensuring that we track and monitor all our processes, because again, no matter what you do, if you do not track what is being done within the hospital, people can go rogue and start doing things that might impact and affect the quality of services that you have put in place. So we'll be training extensively. We'll be getting feedback from clients, and we're monitoring our process into the new year to ensure that things are the way we want them to be.
All right, so that feedback which you just talked about, I need to know how you guys handle feedback within the Rjolad framework.
So we have a robust patient experience team headed by one of our management staff. So what we do is that every single patient that comes into Rjolad hospital, while within the hospital service, even through the outpatient department, before they leave, we have QR codes around across the group where you can easily scan and give us feedback. Then if you give us feedback, we also have the people that go around within the people that are admitted in the hospital. They take feedback from clients every time. Then we ensure that when patients are discharged within the hospital, we also call them to get feedback from the patient experience group. It's a robust patient experience management system, and we ensure that when we get feedback from patients, the positive one we appreciate, the negative feedback we look at them and make improvement from those negative feedbacks.
All right, okay then, so there's a whole lot to look up to in the year 2026.
Yes,
and that's what Dr. Otegwono Ogumo is letting us know this morning as we round off the program. So what's the message really? What are you leaving our listeners with? And even though you guys are really revving in the euphoria or basking in the euphoria of this your award, what's the next thing?
You know, the award came in sometime June this year.
It was earlier this year.
Yeah.
But of course, that has gingered you to step up the game.
Definitely.
Right. So, what's your message to our listeners as we depart the program this morning?
So, because we, just like I said, I really want people to understand what Rjolad is all about. Currently, you need to understand what we are doing. That's why I really want to emphasize our mission as a hospital. So that mission, I can't say talk about it more than enough. I want us to understand that we are trying to build healthier communities, and in doing that, we want to build that healthier community by delivering best in class, patient-centered care through a culture. We are doing it with a culture of teamwork, a culture of innovation, a culture of research, and data-driven excellence. And that's what we want to do 2026. Okay,
then I'm sure from time to time we continue to track all of this.
Yes.
And then we can see if that culture of clinical excellence can continue to radiate with Rjolad Hospital. Dr. Otegwono, it's nice having you in the building. Thank you so much for being here.
Thank you so much, Victor.
Okay, then, so we'll be able to take you through the experience of Rjolad in terms of, bringing in and putting in place clinical excellence that would radiate with you as a patient forever. A brief break. When we return, do our birthdays before we switch gears to how we can make this Christmas season a fun fair for you.